So we always see, increases, but this particular year, there's been a more significant increase in families, parents calling, reaching out to us, expressing concerns about their kids.
As data pours in from across the country, the numbers are alarming. Significant increases in depression, anxiety, and other mental health conditions amongst children. And all signs point to the pandemic as the problem.
This was a particularly challenging stressor just because of the length that it's been occurring, as well as just the sort of global impact on all areas of functioning in terms of academic functioning and social functioning. So, we're just seeing lots of children struggling at this point.
Dr. Jason Lewis, director of the Mood, Anxiety, and Trauma Unit at Children's Hospital of Philadelphia, says social distancing, learning via Zoom, and the constant death toll all played a part in creating a stressful environment for kids, some with deadly consequences. According to the CDC, emergency visits for suicide were up 50% for teen girls this year compared to 2019, and up 4% for boys. What's more, hospitals around the country saw a 31% increase in children 12 to 17 years old seeking help for mental illness, and a 24% increase for kids ages 5 to 11. The numbers are even higher for people of color and those who lack access to care. The issue is maxing out hospital beds, leaving some kids in emergency rooms, sometimes for weeks.
There's always been, unfortunately, a gap between the amount of children and adolescents needing behavioral health treatment and the number of child mental health treatment providers. There's always been a gap. And so now when rates of depression, anxiety, and rates of families calling, looking for services increases, that only widens the gap. And so the stress that the system is under, has been really significant.
If there is a silver lining, it's that telehealth has been greatly improved over the last year, offering help in places there wasn't any readily available. But Dr. Lewis says parents still need to play their part.
First thing is to listen and check in with their kids. Being sad is normal. Having a tough day, feeling angry, irritable is normal. But, listening and seeing, is this sort of how my son or daughter typically is, or is this now a little bit different? Is the sadness kind of extending beyond a day and now we're looking at 4, 5, 6 days? Is she having a hard time sleeping now for a week?
Dr. Lewis also says kids learn a lot from their parents. If they see them coping and managing stress well, the behavior will trickle down to them.
We don't know yet what the long-term effects of COVID are going to be in terms of the impact on the mental health functioning. But what we do know is that children are extremely resilient, oftentimes more resilient than adults. And so I think we have to lean on those resiliency factors and lean on coping strategies that have worked.
Hi, I'm Shirley.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.